I'm Cade Madsen, and this is Supply Chain Management in the healthcare industry. When most people think about healthcare, they picture hospitals, doctors, and patients. But what a lot of people don't realize is that behind every treatment, there's a massive supply chain working nonstop to make sure the right materials arrive at the right place at exactly the right time. And today, I'm going into the field to show you what the healthcare supply chain industry actually looks like, right here in Utah. To start us off, I'm in Tooele, Utah, at a major logistics and transportation hub, where large volumes of industrial chemicals and materials move through every day on rail, in tanks just like you see behind me. Facilities like this one are one of the earliest steps in the healthcare supply chain. Many of the chemicals and raw materials processed and shipped from places just like this one will move on to eventually become medical products, everything from pharmaceuticals to medical equipment. This stage of the supply chain is all about precision, safety, and regulation. Early mistakes in this stage can ripple through the entire system, which is why logistics hubs like this play such a critical role in healthcare. From Tooele, materials and chemicals are often transloaded and shipped here to a FedEx facility in Salt Lake City. This is where healthcare supplies move from manufacturers to hospitals, clinics, and pharmacies. In healthcare, shipping isn't just about speed, it's about reliability. And many medical supplies are time sensitive, temperature controlled, and urgently needed. Delays here can directly affect patient treatment. This part of the supply chain focuses on coordination, tracking, and efficiency to make sure critical medical products arrive safely and on time. From Tooele to Salt Lake, now in Bountiful at Intermountain Health, this is a place where healthcare supply chain transforms into patient care. Hospitals, clinics, and pharmacies rely on accurate inventory management to ensure the right medication and equipment are always available. This leads to a strong supply chain, which then in turn reduces medical errors, prevents shortages, and lowers costs, and improves patient safety. When everything works smoothly behind the scenes, patients receive faster, safer, and more effective treatment. From industrial transport hubs to shipping centers to hospitals, healthcare supply chains are constantly moving behind the scenes. When these systems work well, patients benefit, and when they fail, lives can be at risk. Understanding this process shows why supply chain management is one of the most important and often overlooked parts of modern healthcare. And a couple of key takeaways for me for this project would be that communication and connections are two of the biggest things that help healthcare providers provide and have a really optimized supply chain. Larger and more connected hospitals and clinics have access to more resources, which provides in healthier supply chain management outlooks, while smaller clinics and smaller hospitals have a tougher time with those tasks. This has been Cade Madsen with Supply Chain Management in the healthcare industry.